Let's go west of here and bring in our good friend Ian Rabb from EHN Canada, Edgewood Health Network. Looking great tonight. How you doing, Ian?
Thanks, Rod. I'm doing great. How are you?
Fantastic. So you just heard Rand talking these concepts of recovery right in your wheelhouse. What were some of the things that you were thinking as you heard us talk and how they relate to EHN Canada?
Well, I was thinking that I didn't have to say anything because Rand probably said it all. But the truth is the recovery process for me, and the way I understand it, is treatment is really to treat the acute phase of addiction. Obviously, detoxification first, and then then very much what Rand said. You develop a lot of, you learn to develop a lot of skills around understanding your addiction and have educational programs. I think that every center, and EHN, the one thing about it since I joined and I'm very impressed with, there's a number of centers across Canada, and they all have their own personality and have the ability to manage both mental health and addiction services in different ways. And I find that very attractive. Sandstone, our center in Calgary, has been very effective at dealing with pain patients that become addicted to opiates, as well as everything else. I'm not taking away from the fact that, the majority of people coming into treatment are always alcoholics. Alcohol is still the number one cause and need for treatment. But it really just treats the acute phase. Bellwood, our center in Toronto, does a lot of CBT and DBT and a lot of evidence-based treatment that's very clinical. And they also have programs that are also for more than addiction, meaning they have mental health programs for mood and anxiety problems. So there's a diverse number of programs in our network across the country, and we offer a lot to help people in many ways. We have a great first responders program at Edgewood, which is basically held in a separate building, and we treat the trauma connected to first responders and PTSD, as well as their addiction. So it's multifaceted, but again, I always tell people in my intervention practice, when I intervene on people, when I work with families, that we're really just dealing with the acute phase of addiction. And we really have to manage the fact that at some point you're going to leave the bubble. When you leave the bubble, we have to have you in line so that you know what to do next.
When we talked about the holidays and alcoholism, addiction, and recovery, it's a low time for a lot of people. And now that I think about it, I had a guy text me on Christmas Day from a treatment facility in Ontario. Now that I think about it, I don't know why he was texting me. Shouldn't have had his phone. But anyways, Ian, when it comes to the holidays, can you just speak about the emotions that are coming up for people that are struggling, and then how you're dealing with the pandemic at the Edgewood Health Network facilities in terms of COVID and so forth? I mean, talk about this time of year for people in and out of recovery.
So first of all, I really feel that it would be a really good time during COVID to be in treatment. It's a very interesting time right now. I can only reflect on my own recovery. And I'll tell you that when I first got clean and sober, I spent, during the Christmas and New Year's season, there were 24-hour club rooms in the 12-step fellowships. And I often had to spend time there. My family were all away for the holidays. I was the only one left in Winnipeg, very isolated, similar to COVID, quite honestly, for me. And I had to reach out and be very connected to my community, both recovery and anybody that was in my network of supports. COVID has been a very challenging time. We have not, fortunately, missed the beat at Edgewood, Bellwood, Sandstone, or Nouveau Depart. All of our centers have remained open. I'll tell you the one interesting fact is that we have developed now a number and multiplying daily a number of intensive outpatient programs online, both dealing with just addiction, core addiction, and coming up in January, sex and love addicts addiction and trauma. And we were doing a lot of stuff online. So COVID has forced us really to differentiate programs from inpatient and intensive outpatient, now forcing it online. So COVID, in my opinion, would be a really good time to be in treatment. As you know, in most of the provinces, at least I know in Manitoba, in Ontario, in Alberta, I don't know about Saskatchewan, we're really isolated to our own homes with our immediate family members in our homes. I think it's really changed the dynamic of the family unit, COVID, around treatment. I think a lot of families are really seeing their loved ones through a magnifying glass because we're really not allowed to move around much. And ultimately, people are making a decision to intervene on their loved ones quicker and getting them into treatment, more readily. We're busy now. We're available. The most important message I have is that myself, 24 hours a day, and our Edgewood team, we're available at any of our centers to help people through the Christmas season and through the New Year's season, both with treatment and intensive outpatient programs as well, and with COVID, as we all feel so completely isolated and devastated. It's difficult. It's such a difficult time for people now. I've had, in my life, 53 people that have died since March of overdoses, of people that I'm directly related to and close to. So this is a really, really, really difficult time for people feeling isolated and scared.
Well, I think it's a great time of the year to have you on the program, Ian. And the one thing I love about what you guys are doing at EHN Canada is you're very accessible through social media. Very easy to find on Facebook, Twitter, Instagram. I've tagged you in all of my posts. So maybe if you don't mind, can you speak about your facilities? And then if they've got a loved one or themselves and they're watching tonight, or we can spread the word of recovery, what would be the first step in contacting you folks?
Okay, so first of all, I'll go from west to east. The facility in the West Coast is called Edgewood. It's been around for 35 plus years, over 100 beds. It's got a detoxification unit. It's got a psychiatrist, full-time psychiatrist and medical doctor. Very much similar to what Rand said. The programs include a lot of educational programming and a lot of great groups where peer support, peers really help each other grow through their recovery process. You can actually feel it. The people that come in and have been there for a period of time, they all feel very secure in their third or fourth week. It's a 50-day program. Beds available immediately, usually. There are times we get full and have short wait times, but you can access that by just going on the website, ehncanada.com, and just click on the Edgewood link. Then we get to Calgary, and Sandstone is a very unique boutique property. It's 11 beds, and it really does a lot of specialized work. It, too, has a full-time medical doctor and psychiatrist and a full team of nurses and a counseling team, all social workers and psychologists that work very intensely and very closely with patients. The one beautiful thing about Sandstone, because it's so small, we can develop really individualized treatment programs for people, which I think is amazing. The more individualized it can become, the better off we can have. We can have results and have a great long-term plan for people. Most people stay at Sandstone for a 30-day process, but the longer we can keep, the evidence shows the longer someone stays in the treatment process, the better off the chances are of success. And we see that all along. 60 days of treatment doubles your chances of success in 30 days. But we do have a 30-day program there. We also have, obviously, Bellwood, which is Dr. Bell started Bellwood many, many years ago, 50 years ago. And it's a beautiful campus in Toronto. Very, very highly sophisticated clinical team. Again, psychiatry and medical team right on site. Lots of CBT, cognitive behavioral therapy, dialectical behavioral therapy, and a lot of processing groups and educational groups at Bellwood as well. And then we have our French-speaking or English-speaking in Montreal called Nouveau Depart, which is a beautiful facility in the city of Montreal. It has about 20 beds. And again, we are accessible for everyone through the holidays, 24 hours a day, through our website and our phone number.
Well, I know they're wonderful facilities. I just got to ask you, you didn't get all dressed up for us tonight, did you, Ian? Because remember the first time I met you, I was dressed like you now. And
Yeah.
Like you're overdressed.
I did actually. I did actually get dressed for you tonight, but you don't know what I have on below my waist.
No, we don't want to.
So I put a jacket and a tie and a shirt on, but
right.
I'm sitting at my desk, so I'm quite comfortable. And yeah, I really appreciate being here. We met many years ago, and I've loved watching your journey of recovery. I know all of ours. There's so many similarities and so many differences. And Rob, Rod and Rand, both of us, we've been able to connect on so many levels in this recovery world, which gives me such gratitude, and I'm so thankful to be able to connect with you guys again tonight.
It is amazing. And by the way, I just said, because I got the same thing at my intervention training with our mutual friends, the Hightower group, and I said, listen, if people that's right. I said, if I'm gonna, or people are gonna entrust their health to me, I'm going to dress professionally, and you know what I mean, and take it seriously, which you've done tonight. But Randy, you got a word for Ian before we let him go?
Just one last thing. I just want people to know that people can contact me directly on Facebook at Ian Rabb. Inbox me. I answer every call, and I can also help direct you to whatever service you need.
No, I just would say that I've worked with Ian a lot, and I really trust his judgment on things. And I've used Edgewood a lot myself. Like, I have a lot of clients go through there, and when they come back, Edgewood does a really good job of reconnecting them to somebody in their community who can help transition back into regular life. Like, I run a recovery group, aftercare recovery group, that's sponsored by Edgewood for people that have come through treatment. So they do a good job of follow-up too. So it isn't just going to treatment, hanging out there, and then jumping back into the hot water. There's a good transitional piece built in.
Which is really great, and we have that transitional piece online as well. So people cannot be disconnected. We have an app called the Wagon, and people stay connected to us. And whatever, you're right, Rand, in every big city or small city, we find a person that we entrust our aftercare to, and it works really well to connect people back to their communities.
Well, it looks amazing. You guys are doing great things, as you always do. Ian, great to see you again, and Merry Christmas to everybody at EHN Canada, Edgewood Health Network, and thanks for the time tonight, and maybe most of all, thanks for your partnership with our program, The Recovery Hour.
Thanks, Ian.
Thank you so much. Great to see you guys. Hope to see you live soon.
Okay, take care.